Hello. Ramadan Mubarak. We are planning for the iftar of Ramadan. Whatever, of course, everyone is invited. So the dates and the place will be announced shortly. Okay. Today is to go. We have quizzes while we have to start training, and this is I need to share these thoughts. So the title is training requirements in vision dental clinic, and it's part 1. Training requirements, vision dental clinic, and it is part 1. Really? We have to do training? Looks like boring. I need to come for 8 hours and go for playing by Snapchat or Facebook. Sadly, in this facility, and by the way, most of the high-tech or high-quality facilities, it is required. Let's go one by one. Let's go the DMA way. Okay, let's go for this story. Every relation between any identities, even a male and female, husband and wife, grocery and shopper, it should be mutual or symbiosis. This is the Latin word. I should get benefit and you should get benefit. So for an example of a regular work relationship between what do vision staff needs versus what does vision facility needs. طيب, let's go for this story. I have made it maybe 1 or 2 years ago. Everyone, including myself, we need to be happy, and we discussed this before. I can offer you 20% of happiness. Your other 80% is inside you. So I'm referring to the 20% that any human can give it to you, which is, let's go for a little definitions. You need for your salary to be safe and your extra hours to be safe. This goes to me also. So this is the humble definition of happiness inside our work. Of course, I need to take 1 million salary a month anyhow, but this is not my personal problem. We are referring to the market. So I think we are managing with the market for this thing. So I don't need anyone to bug me in my salary. I don't need anyone to bug me in extra hour. Agree, disagree? Agree. That's nice. So there is to be happy. You cannot be in air. You should be stable on a table. This table of recruitment has mostly three tripods or 3 legs. You are counted mostly about how many tasks you are doing. That's why everyone writing in his CV, multitasking, working under pressure. You know this? You know what did you write in your CV? Yes. So you have been evaluated in reality, not in CV. How many tasks that you can do. Then, like, sorry, I'll go without any names. Yeah, Jane, I will not mention any names. I'm doing the medical codes, and now we're finishing the EMR, and now we have to book appointments. Then patient go outside, my receptionist tell him, Do you have your appointment inside? He said no. This is a true story. Patient said no. Then when we go inside, there is a booking of appointment. Appointment was booked. So when we discuss with our nurse, I am too busy. I am very overexhausted. I am doing the EMR and doctor is shouting, this is too much multitasking. So this is an example for how multitasks is required in my job and in every other job, and specializing healthcare business. Yes, it's healthcare business, it's annoying. So how many tasks that you can go, and how many bracketed tasks that you can do, you can go. For healthcare, you cannot run without brackets, because patient check-in, it's a check-in. You have to make a filling, you have to make a filling, so it's bracketed. This is, I suffer from the back-end guys. Doing hiring. Yes, I'm ongoing finishing the labor contract of Peter. Where's Peter?
I'm here.
Yes. Ongoing cancellation of that visa. Ongoing, this is a pure example for unbracketed table. I am following up with the blah 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 blah. So for healthcare front office, it's difficult to leave open, even with places by the check-in, the forwarding, the visit completed, the discharge, and we are pushing as far as possible in the bracketing. That's why we don't like My Smile, because it's bracketing your tasks. So this is number 2 is required from you. Number 3 is how many disasters that you have done, and this is a little bit of luck there. Sometimes you can do double booking, but thanks God, one patient will miss. So you are saved. But if you have problems with your mama, and mama is angry from you, and you do double booking, and 2 patients are in the same time in the facility, that's you give us a critical results. If you are missing for sterilization or following sterilization, or not reporting a non-functioning autoclave, and we have a little bit 1 hour delay, you run away, you saved your neck. So this number 3 is a little bit with luck. So this is what you need, and this is any job, including my job, needs. Okay? So what the facility is, sadly you will not be safe enough. You will not be safe enough by doing your tasks. And this is how quality organizations are working. And with all respect, whatever you are happy with us, not happy with us, we are one of the very high quality organizations in dentistry. So doing your tasks only, sadly, in high quality organization, including ourselves, is not enough. Your tasks should achieve the goals of the facility. Your tasks, you might doing 100 tasks, but it's not achieving the goals of the facility. Or you are doing 1,000 tasks, and you have every day you have 1 or 2 or 3 of this criticality, and then you go for winning of, I am doing 100 things. Why you are always angry from these disasters? Oh, what should I reply? So, you know what is vision goals, huh? Our specific vision goals. What's number 1? Huh?
High technology.
This is the vision, but I make it, yes. Doing this will reach this. The goals is about the patient first, and proper operations and profitability. And of course, the other way is, which is higher level, strategic level, we are looking for high technology, high quality, patient comfort. Okay, so this is the debate. You want this, you do this, you achieve this. It's not as easy as possible, and sadly being a, and I say sadly being a university staff, till associate, almost associate professor for 17 years in universities, I was not looking to go for training, but sadly, this is the only way. This is the only way to move you, to help you to move from your tasks into goals. And I don't have bad feelings with you. Maybe I don't love you, but rest assured, usually I don't hate you. I'm really looking for you to be happy, as the definition of happiness. I cannot solve your childhood problems. I don't solve the guys in the schools in the 7th grade who's bullying you. I don't have solutions for this, but at least the 20% that I'm responsible for, to give you safe salary and to give you non-extended, non-exhausting work, is to make your tasks managing with the goals. So this is what I'm gonna speak about. Okay, this lecture is mostly emotional. It's not about real thing, but it's based on the quality audit that has been done by Dr. Monawali, and maybe one third of the comments was talking about training, and I have like two teams, Royal and Barca. One team, too much training, this is waste of time, versus the other team, wow, this training is nice. So let's go for the DMA for this training. Cool? Did you lose me? Okay, so here there is nothing official. Now I will start. I forgot this. The terminology bar. This is what we call current performance, and this is called desired performance. So the first sentence that I need you to write is training. The purpose or the objective of trainings is to improve the performance from current. The objective of training is, this is required, write it please. Ibrahim. بتعرف تكتب ولا لا؟ The objective is training is to transfer the facility from current performance to desired performance. Where is Marvin and Lawrence? Lawrence? طيب, I started with the objective. We started with why. So title number 1 requires is the objectives. One, objectives. 2, definition. It's not stable here, Muhammad. Okay, what do we mean by training? I use the DMA way. Is we give you to make you more productive. We give you knowledge, skills, ability to master. They call it KSA. So this is to write, please. Knowledge, skills, ability to master. By the way, this is my own wording. If you can remember, know what to do, which is the knowledge. Know what to do, know what. Do how, which is the skill. Or do what, by the way. Do how or show how is the mastering, is the doing the thing without mistakes, doing the thing without many problems. What to do, how to master. Many guys doing implants, but how many implants is done in a least time without using 2-3 implants, without using much trauma, without opening big flap? This is the difference between the skill and the ability to master. So this is point number 2 in this lecture, because there I'm planning to go for an intensive training program for the whole facility, starting of course by the front end. طيب, terminology of, I just need you to be oriented. TNA, it's a little bit of HR word, human resources word. Training needs analysis. Anyhow, this is the process. Write it please, this is the third, I need from you 3 or 5 topics. This is the third topic, or the third line. It should in your official training. What is training need analysis? It is identifying the training required, to close the gap. You remember which gap in the first slide? Exactly. Between current performance and desired performance. So my only objective of this small training, by the way, we are now running the Jawda audit, and the auditor is in the 12th floor. So the main objective of this whole lecture is just not to answer the question, why training? So how we plan it, it's a little bit technical. Know goals, objectives of your business, which is patient first, proper operation, profitability. Then, to achieve this, we have to have job roles and responsibilities. Then, I will assess my staff. You remember a KSA, which is, I am really surprised how it is fantastic, but the other F, which is we are in Ramadan. Then assess your goals, assess your staff power. There is a middle link which is called the job description. Then assess the gap analysis, which is the TNA. Then we're gonna develop and implement training programs at this. So each training program, or each training lecture, or each training attended by even other seniors. Dr. Salim, I think, is running now current Sunday, stable Sunday with the nurses. So every and each training should, and I think Ms. Heba and or / Sherry will go for another consistent training for the reception. So this is gonna be, I will have one full facility, which is not obligatory to be weekly, but I will allow minor, small weekly training of course, following these targets. Insurance also, yeah, Mary Grace, which is she's busy with the auditor now. طيب. I will end this lecture by only discussing the gaps, gap analysis between current and desired. So I will go for an example because this is I need to make for training, and I will need also to use it in the auto-crediting system. Ms. Seba, can we announce, are we ready for the staff of the month?
Yeah, by the end, yeah.
Are we ready?
Yeah, but you have the card.
Do we have the card here, Peter?
It's not about.
Okay, we can announce it in physical.
This week, ولا
لا, we'll announce. It's gonna be physical. A gold card or platinum card? Gold. It's once monthly, I'm saying. Make it platinum. Okay. طيب. Gaps, and I will start now sharing. This is what during of analysis of three months, or actually 1 year. This is what we have. I will start with, everyone will share with me. This is the gaps or the mistakes or the faults that we see in the reception team. Start with Jubail, just read. What does that mean? Not same patient. Sorry, yes, sorry, yeah. Duplicate. This is the duplicate. Yes, we do this. Marifin. What does that mean? You know the units? Okay. 2 units, 3 units. Yes, if I have patient having 2 units, and on top of him I have patient having 4 units. So yes, and we do this. We put the patient on with the 4 units on top of the patient of 2 units. Happen? Did not happen? Thank you. Who's next? Jessica?
Creating a new chart for existing patient, not checking additional clinical numbers.
Guilty as charged. Rachel?
Leaving abandoned calls, WhatsApp, SMS, till next day, Arabic and English.
Arabic and English. And if I have Arabic, I don't refer it to someone. Sherry?
Not calling back patient within a shift timing to answer any queries. If you don't know, call back. Apologies for delay. Set tomorrow follow up again.
Yeah, how many times we receive angry patients? We will call you, sir. 9 days ago, 1 month ago. Next, Joel.
Talking to the patient on the phone or in premises in an unprofessional way.
Yeah, it's not common anymore, but it was usually in phone and with way sub professional staff. They are not with us anymore. Reason?
You take information to be in the 48 hours window.
Oh, busted. How many times they complained you, yeah, reason for this? Next.
Who's next?
Orlando.
Wrong confirmation for an unready patient.
Busted also. How many times we confirm a patient with a lab missing? Yes, yeah, you are making it. You are feeling as a joke, but this is the gap that I had to fix. I'm really overwhelmed. Diana.
Wrong or missing checking documents.
You know what is example for? I know it's not your business, but do you know what you usually take in the check-in documents? The ID, Emirates, valid, the insurance, the eligibility check, anyhow. Yes, it's still happening. Geo?
Not reporting any occurrence incidents will make the facility not ample, not cozy for the patient.
Give example.
Is there any faulty equipment and you don't report it to the reference?
Just give an example. Real example.
No lights or smoke detector is not working properly.
Smoke detectors is not related to the ramp.
The lights or the dental chair.
Dental chair is not related to the ramp.
Lights buffer.
Lights, air conditions, vending machine, TV. Next, which is Aubrey. Yes, this is one of the big black holes that we lose. That black, it's a real astronomy black hole. We lose our patient inside the room. طيب, Ibrahim.
Wrong handling the lead patient.
Okay, when we have a late patient, we don't punish him. And this is that we are sadly doing proudly.
But we don't punish. But
Yeah, I'm only talking today about the gaps. These gaps will be involved in further training and will be involved in the auto credit. This is, I'm showing my team where are we. So this is the only to discuss. Yes, it's, as I told you, it's an emotional lecture rather than 1, 2, 3. Of course, 1, 2, 3 is coming. Your turn, ya Ms. Heba.
waiting time more than 30 minutes.
Sadly, we reach
Slash treatment.
we reach sadly 26% of our patients. 26. We have sometimes records reach 1/4 of our patients in which we are not fully equipped facility. We're around 66 or 70% occupied, as based on 45 minutes per patient, and we sometimes 14%, sometimes 12%, and our record is 26%. طيب, Rami?
Non-reporting any patient complaint, verbal or written, RAB, TTT.
Yes, there is a credit, there is a hat, you're gonna choose the hat. Please give us one complaint, you take one silver hat. Please promote our patients. No need to write, you can write for their behalf. So please give us one complaint, we give you one silver card. Mean, yeah? Who's hiding?
Mario.
Mario.
Not clicking being seen when patient enter the treatment room.
Okay, it's, you missed it, it's definitely from the RAP, but in contrary, not clicking forward the visit after finishing the treatment. Razil?
Over treatment time more than 30 minutes.
Yes, this is, yeah, I know that this is treatment, but this is directly affecting the RAP. Who's next at the back? Andy? Andy or Edwin? Edwin.
Not preparing other communication documents required for checkout, prescription referrals, sick leave, post-operative instructions.
Patient communication, prescriptions, referral, sick leaves, post-operative instructions, which is treatment, but it also affects heavily the discharge time. I did not finish yet. Big headache. And
Late forwarding, click the patient to check out.
Lawyer Mario. Of course, this will also affect the discharge time. Who's next? Dr. Asma?
Wrong, missing, change
changing treatment codes, which interfere the invoicing.
This is pure, exactly. See, it is purely treatment, and it's even being audited now, but this will affect the invoicing. The invoicing will affect the patient discharge. That's why it's a domino dancing. Lots of domino dancing. I'm not the bad guy here. Healthcare business is the bad guy. Who's next?
Patients without next appointment.
Yes, remind you with someone. You're not the admin, huh? You're the admin, yes. طيب. Nada. Dana.
Not communicating with the patient, asking about the experience, promoting him to active participation in the certification.
Okay, this is a little bit high quality, but it matches you. Please, we do this for our patients. And I noticed Rami was doing it well. Hello, how are you? Marhaba, how it goes? Any masakhit? Any pain? Was it okay? And this was, maybe other stuff are okay, but because Rami is my agent and I have to comment that he's doing it well. Who's next? Jane?
Working without patient knowing his appointment details.
And this, I just mentioned it 20 minutes ago. Okay, of course we don't book a patient appointment without his knowledge. Who's next? Mariam?
Not checking other communications and then prescription referrals, sick leave, post-operative instructions.
This is for the reception. Not doing is a disaster. Then doing and not giving is another disaster. And yes, it happens in many hospitals, by the way. She went with her son, which is our son, for a hospital, and he has adenoids, and they prescribed an antibiotic 1 week ago. 1 week ago, and we didn't receive it yet. And the most sarcastic is that the doctor is my brother, and he's working in Mediclinic, the huge Mediclinic hospital. So yes, bullshit is happening, and I will fight it as hard as possible. Who was next? Muhammad?
Missing below not documenting payment collection as paid RCN, co-pay, FP, direct billing.
Yes, this will affect directly our profitability. Dr. Salim?
From you say check out the docs, check insurance, auto credit.
It's coming later. Anyhow, my message is clear. I will, and I don't want to go, sorry, Aljan?
Discharge overtime more than 10 minutes.
Discharge overtime, which is mostly, it's a dominant dancing for one or more of the previouses. طيب, I will pass this is a little bit admin, and I will jump for the treatments of treatments problems. Doctors have only 2 problems with me. Only 2 problems with me, in addition to what will affect the RAP and the insurance. Missing wrong EMR with whatever the coding thinks. Missing or wrong treatment guidelines. I don't owe you anything. Additional, of course, it will not affect the patient registration and appointment. So this is the end of this lecture. I'm announcing the individual departmental training. I'm announcing the auto credit system. It will be, if we have by the way, I intentionally didn't say it with my mouse. I was fully sure that you say it, you accept it. So rather than make an IR, then investigation, then warning and blah blah blah, it will, you just you overrule this number 32. By the way, there are 50. I have 50 mistakes only in receiving a patient in and out. This is 50 because reported repeated mistakes. So this 50, and I have my officers will help me on this. She should be in this part, Mary Grace should be this part, Miss Heba should be supervising this. So we will have no hard feeling that this is what we are. I'm offering training, I'm offering what is wrong, I'm offering how to match it, but I have to have a reference that we are dealing or referring to. Can Miss Heba now announce the staff of the month?
Mirna is the staff of the month. Not only attendance, not only performance, not only any complaint or any issue. She's always like really a busy bee, everywhere, outside, inside, up and down.
But this is a platinum
Taking
card. Thank you. Enjoy. Give the paper to the manager. See you next time.